You know that feeling, right? When you walk into a space that just feels right. And then there are those other places that feel sterile and cold. Well, today, we're going to explore why that feeling matters so much, especially how thoughtful design is absolutely essential for providing dignity in Canadian hospice care. So, this really brings us to the central question. How do we actually design physical spaces that offer comfort, compassion, and real dignity when people are at their most vulnerable? It's a huge challenge, and it sits right at the heart of modern healthcare. And the answer? Well, it's not so simple. To really get why this conversation is so urgent, we first need to kind of zoom out and take a look at a major challenge that Canada is facing right now. Okay, so the fundamental issue here really comes down to demographics. As Canada's population gets older, a really serious gap is opening up between the number of specialized hospice beds we have, and by that I mean care that's focused on comfort and quality of life, not just clinical treatment, and the number that's actually recommended by national standards. And this is where you see the domino effect. A shortage of beds isn't just a statistic. It puts immense pressure on public hospitals, which often aren't set up for this kind of specific end-of-life care. And even more importantly, it shifts an enormous burden onto families, who are already trying to get through an incredibly difficult time. So if that's the challenge, what's the solution? What should we be aiming for? That brings us to a new vision for what end-of-life care can be, and what it really should be. At its core, hospice care is really a fundamental shift in philosophy. Instead of focusing only on clinical outcomes, the goal becomes something much more holistic. We're talking comfort, dignity, and the best possible quality of life. And this quote just captures the goal perfectly. It's all about moving away from that cold, sterile feeling of an institution and creating something that feels more like a home, a serene, residential space where people can genuinely be at peace. Okay, so how do we get there? How do we build that bridge between the problem we're facing and this compassionate vision? Well, the answer lies in design. And the critical point here is that creating these kinds of spaces doesn't happen by accident. No way. It demands a deliberate, thoughtful, and functional approach to design, where every single choice is made with the residents, their families, and the staff in mind. And when we really dig into the details, you start to see what this means. We're talking about layouts that feel nurturing but are also intensely practical, like rooms with easy access to natural light and green spaces. It's about designing for everyone, not just the patient, but also their family and the staff. Every element has to promote tranquility while making sure the essentials, like privacy and just being able to move around easily, are baked right in from the very beginning. All right, let's zoom in now from the big picture of design to the specific tools that actually make these compassionate spaces a reality. And this is exactly where specialized partners become so essential. You have companies like Omland Hospitality that focus on equipping these very unique environments. They provide the crucial physical tools, the furniture and fixtures that allow a compassionate design philosophy to actually come to life. This table breaks it down so well. It's not about just getting any furniture. Purpose-built furnishings are designed to meet really high standards for safety and usability. Think of chairs that are easier to get in and out of, or surfaces that are simple to clean. The durable, ergonomic design ensures both patient comfort and long-term use. And a focus on quality means these facilities can minimize expensive maintenance and put their resources where they really matter most, on care. So you can see the impact as a clear three-step process. First, you supply the right specialized products, like adaptable beds or supportive seating. This, in turn, enables the healthcare providers to stop managing the environment and focus completely on their patients. And the final result? You get a space that achieves that delicate, crucial balance between comfort and dignity. So what happens when you combine this thoughtful design philosophy with the right specialized tools? Well, you get a powerful, integrated approach that has a really profound impact. This comparison, it really says it all. On one side, you have the traditional institutional setting. It's cold, it's functional, it's focused only on clinical needs, and it often leads to isolation. But on the other side, you have the modern hospice environment, warm, residential, focused on dignity, and built to support family and community connection. Ultimately, the results of this whole evolution is a space that achieves something more. It stops being merely functional, and it becomes what it was always meant to be, a place of profound compassion. And that leaves us with a final, crucial question to consider. As the need for these services continues to grow all across North America, we have to keep asking ourselves, are we simply designing for function, or are we truly designing for human dignity? Because the answer to that is going to shape the future of care for generations to come.